Pre-implantation genetic screening, or PGS, is an assisted reproductive treatment where we undertake the genetic analysis of the embryo and replace a genetically normal embryo back into the womb. This is also commonly referred to as comprehensive chromosome screening, or CS. As part of the treatment, the patients have to go through an IVF treatment process, which will involve taking the fertility drugs, going through the egg collection, and once the eggs have been collected and inseminated, the embryos will be cultured up to blastocyst, or day 5 stage. At the blastocyst stage, we will then take few cells from the embryo, and these cells will then be subjected to the genetic analysis using the next generation sequencing platform, and we will then we will then assess which of these embryos are genetically normal. After the genetic analysis has been performed, we will then start another cycle for yourself, and these genetically normal embryo 1 or 2 would be replaced back into the womb in a frozen embryo replacement cycle. This intervention is of more relevance to patients, for example, women trying for pregnancy maybe over 38 or 40, where there is a higher incidence of the genetic errors in the embryo, leading to the reduction of the fertility rates and the higher incidence of genetic problems in the baby, such as Down syndrome or trisomy 18 or 13. So this can also be of relevance to patients with repeated treatment failures, because repeated treatment failures can either be related to the failure of the implantation or to the embryo health. So assessing the embryo health, and only one aspect that we understand as of now, is a little bit more about the genetics. So by testing the embryos for the genetic normality, we are trying to correct one of the potential factors that might be contributing to the treatment failures or recurrent implantation failure. The other group of patients would be repeated miscarriages. If patients have had multiple miscarriages which have been less than 12 weeks in gestation, 60% of these miscarriages could be genetic in nature. So by doing pre-implantation genetic screening and replacing a genetically normal embryo back, we are hoping to correct the problem and leading to an ongoing pregnancy and a childbirth. We also offer pre-implantation genetic diagnosis. Pre-implantation genetic diagnosis is of relevance to the patients with single gene disorders or maybe double gene disorders, but largely it is for single gene disorders. This is generally, for these cases, the NHS funding for the treatment should be available, and if you would want to explore this, then it would require initial assessment of the genetic condition, an involvement of a clinical geneticist, and then planning your treatment. So these are some of the other genetic services that we offer at the clinic.